Thanks for joining us today. I'm Dr. McDonald, Clinical Director of the Knee Clinic. We're going to take a little bit of time and go through what's unique about our online knee clinic. We are Canada's first and only to date online knee clinic. In 2010, our clinic began here in Calgary, Alberta, when the need became obvious for the disparity between the public and private systems. As I was going through my postdoctoral fellowship, I was attending knee rounds at the local university every Wednesday. At the university, they have a really wonderful, publicly funded acute knee injury clinic. And it's very successful and it's very good, but it's sometimes limited by its own success. The acute nature of its name implies that they will only see people with acute knee injuries. That means people who have injured their knee within the last 6 weeks. Every year in Alberta alone, there are between 110 and 140,000 knee injuries. The majority of these people who injure their knee never see anybody. The few that do will often see their family physician. And while a family physician's role is to try to keep you alive and keep you in good health, admittedly, they are not supposed to be experts at the orthopedics of a knee. At the acute knee injury clinic, they were having difficulty seeing patients in a timely enough fashion to meet their criteria of their acute knee injury clinic. Alberta Health Services at one stage had set a mandate for them to be able to see somebody with an injured knee within 72 hours of that person phoning. By their own admission, they were meeting this criteria 1.2% of the time. And so one day it became pretty obvious to me that a private alternative was going to be necessary. We started our private knee clinic in 2010, and it took off right away. Now, as we fast forward to 2021, we're expanding the success of our knee clinic to this online knee clinic forum. You can learn more about our services by visiting us at kneeclinic.ca. I'm going to take the next few minutes to go through the full assortment of different knee braces that we offer through our knee clinic website. You can also have a telehealth consultation with one of our doctors, and you can click on this right from our website. These telehealth consults are really unique because they allow us to actually have a visual as well as the auditory component, allowing us to have a full history and to be able to watch the mechanics of your knee both statically as well as watching you walk. And although this doesn't take the place of a hands-on physical examination, it really can often give us a good indication of what direction your knee is going in and what likely things would be most beneficial for you. We can offer prescriptions for various knee braces that can often be covered by your private healthcare plan if you so have one. The merits of your plan will dictate the extent to which your knee brace will be covered. And if you need local care, we can help to coordinate whatever you need with one of the clinicians that's in a nearby town or city, whenever it's available. We can also have our physiotherapists have a consultation with you to go over all the exercises that you could be doing on your own at home. Our approach to a knee is very often falling within 3 similar pillars. Step 1 is to treat the actual problem. In this day and age, it doesn't count to just be close with diagnoses. It's really important to try to have it bang on as often as possible. Step 2 is to strengthen the area. With strength comes stability, and with stability comes less pain, always. This is no more true than in the knee. Because it has such a unique confluence of demands, the knee requires spectacular amounts of strength while simultaneously being stable and being able to move quickly through a very large range of motion. These are uniquely divergent goals and something that is really hard to do well with everything. The knee normally does a wonderful job of this, but always will benefit from being stronger. Our therapists can put together a customized strengthening program for you, and they can guide you through the appropriate techniques to make sure that you're doing it exactly right. By visiting kneeclinic.ca, you'll be led to our main page. From this main page, you're going to see the green box that says Shop Knee Braces. Clicking on that is going to open up the page that allows you to view all of the different knee braces that we offer, with all the different sizing options, including charts on how to make sure that you're getting the right size, and documentation on how to make sure that you're fitting it properly. Most of the different knee braces that we offer will also have videos associated that demonstrate how to wear it and fit it correctly. From this shop page, you can request a consultation with one of our doctors. Once you've clicked on this Request a Consult page, you'll have to fill out a little bit of information so that we can make sure that we can get in touch with you and arrange a time that is convenient for both you and one of our doctors. There's a pull-down menu where you can give us some insight already on any prior knee diagnoses that you've had, or even a hunch that you may think is wrong with your knee. During our online consultation, we'll take our time to go through a full history and actually be able to watch you walk so that we can pick up some of the mechanical aberrations that are taking place within your knee. Let us know about any prior surgeries that you've had and any current care that you're receiving. Once you're ready to purchase a knee brace, you can select the actual brace right from our website. Clicking on the Select Option tab will give you the option of seeing different sizes, as well as description about the brace. From there, you can actually complete your checkout for the brace. Remember that we offer free shipping on all brace orders, as well as a money-back, no questions asked, 30-day guarantee. Okay, so we're going to take some time here and go through some of the various knee braces that we offer on our clinic website, kneeclinic.ca. We have a full range of braces from very mild on to much more significant braces for myriad different clinical indications. The first, least expensive, and probably easiest brace for us to use is this one by Bauerfeind. Bauerfeind is a German company, and they make several unique braces that we offer on our website. This one's simply called a Genutrain, and in Latin, genu means knee. And this one is quite easy to put on. It's a pull-up style brace. It's not custom, but you can actually fit it pretty accurately using the size guide on the website. The principal advantage of this knee brace is for something called mechanoreception. That is to say, the stimulus of small sensors in your skin called mechanoreceptors. The more that these sensors are activated, the more awake your brain becomes to the motions that your knee is actually doing. So in a sense, this actually just allows you to be more aware of the position of your knee relative to space. If we fold this one inside out, you'll see that it has a couple of handholds to be able to grasp with your thumbs to help pull the brace all the way up your leg. The most important feature with this brace is to make sure that you pull it on high enough such that your kneecap sits perfectly within this little divot within the brace. Most of the people that I see wearing this brace will sort of stop 9/10 of the way up, but you have to pull that last little bit in order to be able to get it all the way around the kneecap. And you'll feel when it's right, because there's quite a padded, buttressed area all around the knee brace to be able to actually help to create more stability around the kneecap itself. A wonderful, easy brace to put on. It is machine washable. Don't put it in the dryer, I don't think. But otherwise, very, very versatile for a range of different activities, and good for cases where you simply want to improve measurably the amount of stability within your knee. Although I confess, this brace is not going to stop any particular ligament injury, nor is it unloading a particular part of the knee. It's rather simply squeezing and trying to create stimulus to those mechanoreceptors. This next knee brace is one of my personal favorites for people who are playing sports and have patellar or peripatellar knee issues. This brace is by a company called Push, and over the years we've tried many different peripatellar stabilization knee braces. Some of them bind up behind the knee, many of them slide down, and they really don't do that good of a job of controlling the motion of a kneecap that is a bit too willing to move. Some of you will have discovered that you can have a kneecap sublux, which is to say partially dislocate, and some of you, unfortunately, will have dealt with actual true patellar dislocations. This is the case where the kneecap literally comes all the way off to the side. A lot of patients will tell me that their knee has dislocated before, but those who truly have had a knee dislocation will know it without any gray area whatsoever. It's quite a dramatic thing to have happen. This patellar stabilization brace helps to stabilize all of the area around the kneecap, and it helps to reduce any of the extraneous motions of the kneecap. What I like particularly about this brace is the fact that it's very lightweight and it does not bind behind the knee like so many other stabilization braces do. The way to put this one on is a simple pattern of 4 different Velcro straps, and they're numbered so that you can kind of know which one you're going to be putting on first. The fact that it's wider at the top allows you to get on the brace a little more easily, especially if you have a proportionally larger thigh to the diameter of your calf muscle. This brace should be worn quite snugly, and what I really also like about this brace is that it allows you to customize the fit specific to your needs by pulling the strap over a little bit more or a little bit less, so that you can end up getting a very, very comfortable feel all around the kneecap. This is our next brace, also from Bauerfeind, and unlike the prior Genutrain, this one is called a Genutrain OA. It falls into the category of a custom fitted brace, and as such, your doctor from our Knee Clinic website can usually write you a prescription to allow you to get some coverage for a custom fitted device for this particular brace. This brace enjoys all the same benefits of the prior Genutrain insofar as it's very easy to put on. It has the same thumb tabs, and in this case also it has loops to be able to help you pull the brace all the way up. Much like the Genutrain, you have to pull it up high enough to be able to get your kneecap smack dab in the middle of this little demarcated area. But unlike the prior Genutrain, this one also has the visible unloading system built into it, and it works surprisingly well. Much like a ski boot attachment or a snowboard boot, you have an actual ratchet that you pop open to begin with. That allows you to loosen the straps off so that you can put the brace on more easily. When it comes time to put the brace on, after you've slid it all the way up, you take these two little strings, these are the cords that actually hold the brace unloader in place, and once you've pulled them out a little bit, you actually want to bend your knee in or out depending on whether you're trying to medially unload or laterally unload. And when we look on the website, you'll be able to see videos demonstrating how to put this brace on, as well as some instructions to make sure you're doing it correctly. But in essence, once you have the brace pulled all the way up, you're going to tilt your knee over a little bit so that you can get access to this dial. You push the dial down, and now you're going to start to turn and tighten the brace as far as it comfortably will go with your knee torqued in. Once you have it as tight as it will go, then you can stand up, and now in an upright position, you're going to be able to get a couple of extra clicks out of it. This brace does a surprisingly good job of actually unloading the knee. In certain braces that we'll talk about next, they unload by pulling the one side of the knee. This brace is a bit different. It pushes the one side of the knee in order to gap the opposing side open. This brace is going to look familiar because it actually does look quite similar to our Össur Unloader 1. This has a different name, however. It's called the Rebound Cartilage, and the particular clinical indications for this are quite unique. This brace does very well at helping someone after they've had meniscal surgery. We don't often think about a knee brace for a meniscus issue, but there's an important reason why we should. Every time that we take out any part of a meniscus or even repair a meniscus surgically, we are changing the loading characteristics to that meniscus. This means that the way the joint moves is slightly but forever altered. With the Rebound Cartilage Unloader, we're able to offload pressure or compression around that damaged or healing meniscus in such a way that it allows it to have more breathing room and consequently less cause for future injury. If you think about the mechanics of a meniscus, it is effectively much like the meat in a sandwich. Every time you take a step, you're compressing and squashing this meniscus. Every time you plant and twist, you're putting a shear load into that meniscus that really can often lead to some degree of pain or injury. With this Rebound Cartilage Unloader, the brace literally gaps open that part of the joint, allowing the meniscus the freedom to move and having less irritation placed upon it. One of the other unique features about this particular brace is the way that the straps function. These straps, very similar to the straps of an Unloader 1, are slightly different insofar as they begin to kick in earlier in the degree of flexion. At 30 degrees of knee flexion, they're actually doing a significant unloading of that part of the knee. Compare that to the Unloader 1, which doesn't kick in until 45 degrees. So effectively, this one is beginning to offload that irritated part of the knee 15 degrees earlier than our Unloader 1. I also like this knee brace because it is very lightweight, very easy to put on, and it already has a sleeve built into the brace so that we can actually decrease any irritation to the skin. It's quite a good brace, quite easy to put on, and again, like some of our other braces, comes in both a custom form as well as an off-the-shelf version. This brace is by far our most popular brace, not only on our Knee Clinic website, but also in our private practice. Made by a company called Össur, this is the Unloader 1. This brace also comes in several different variants. The Unloader 1, there's a larger, bulkier version for heavier patients called the Unloader 1 Plus, and there's actually a thinner version called the Unloader 1X. All three of them, however, have a same key feature, and that is that they unload specifically one compartment of the knee. Every time that we take a step when we're walking, we absorb 1.5 times our body weight approximately. Do a quick bit of math in your own head and you'll see that this is a very significant number, even in lightweight people. 80% of that mechanical load with every step comes up through the medial or inside portion of the knee. And as a consequence, it's no surprise that the inside portion of the knee, that is to say the medial compartment, is by far the most common and first area to wear down in most people's knees. Of course, there are exceptions to this, but generally, this is the brace that we would use for particular unloading of either a medial or lateral compartment. The way the brace works is pretty interesting. There are 2 buckles and there are 2 dials. The buckles are butterfly clasps. To open it, you have to dig your finger in, pull, and pop it open. It unfolds, at which time you can then slide this little buckle right out of the trough, and you'll notice blue and blue on the bottom. You do the same thing on the top, and it's yellow and yellow. So you really can't screw it up. There are then 2 dials, and these dials, much like the dial that we saw on the prior Genutrain unloader, these dials allow us to actually tighten up the straps. And with this, you want to tighten the dial to the point where you actually have this little yellow marker somewhere around the middle window. Now this relies heavily on your ability to adjust the straps yourself. And we have videos on how to do this on our kneeclinic.ca website. There's also documentation in case you get yourself a little bit stuck. And if all else fails, we're happy to do a telehealth consult with you to be able to figure out exactly how much you need to be trimming these. By trying to get it into the middle window, what we're actually accomplishing is the ability to give you adjustability, either tighter or looser as you see fit throughout the span of the day. One thing a lot of people don't realize is that our legs do not stay the same diameter. Sometimes they're swollen, sometimes we're dehydrated, and this can change hour to hour, day to day. And as a consequence, this brace has the unique ability to allow us to adjust for those changes in leg swelling or in leg dehydration. Once you have the brace on, you do so, actually I should show you, by tightening up both of these buckles. The order of operations is important. You actually want to do the bottom buckle first, and the reason why that's important is because this bottom material is a silicone base that's very sticky. You want it to be sticky so that it grips onto your calf, therefore decreasing the chance of the brace sliding down. Conversely, the material on the top is actually quite slippery, and some people get thrown off when they first put this brace on because they'll feel the brace sliding around their thigh and they think that that's a bad sign. It's actually totally natural and quite important for the top part of the brace to glide a little bit every time you flex or extend the leg. Conversely, the bottom part should stay stuck completely, and that's why it has that silicone material. Once in a while, if somebody has sensitive skin, this silicone will grip hard enough that it can actually create a rash. If that happens, just take a couple days off without the brace, and then you can try it again. The skin usually has desensitized by that stage. But back to putting on this knee brace. When we start, you have to make sure that the knee brace is going to be laid down high enough on your knee. And for that to happen, my personal and professional opinion is to try to find the bottom of your knee cap and make sure that it lines up with the bottom of this hinge. Now, the actual technical specifications will say this a little bit differently, and so do the fitment videos. But one of my hot tips for this is when you're sitting down, slide your bum forward on the front edge of the chair, and as you lay the brace down, use the bottom of your kneecap as a guide, and make sure that as you make an imaginary line straight across, it should line up with the very bottom of this hinge. Assuming that you've got that done, now we come around with this bottom blue bracket, put it into the trough, and we put it on. But we're not finished yet. There's a little bracket here, a little shelf rather, that you actually have to sit this bracket on top of. Once you have it sitting on top of this lip, you're going to close the bracket until it audibly clicks. Then you can do the top one. Same process, but there's no shelf for this one to sit on. It just goes into the trough, and then you close that one. Once they're both closed, you're going to tighten these dials up to the predetermined level. One of the tricks for finding out where that level is for you is to turn them tighter until they're moderately tight when you're sitting. Then stand up and lock your leg totally straight. Once it's totally straight, and while it's totally straight, bend down from the waist and tighten the dials up pretty much as tight as they can comfortably go. That's the sweet spot because it tells us that you're actually going to have the maximal amount of unloading during the straight-legged stance phase of gait. That's the most important time for this brace to do its best job. This is a very comfortable brace, and it does come in both a normal length and a short length. I usually use a cutoff of around 5'6", 5'7" as the cutoff to start choosing a short version of the brace. 5'8" or taller, you can usually get around just fine with the normal height one. This brace is the one that I am both personally and professionally most familiar with. This is the CTI, made by Össur. I've worn these since I was a teenager racing motorcycles, and I wear them as a form of prevention because, just like you, I don't want to have an injured knee. This CTI is a carbon fiber brace that can come either as a fully custom device measured down to the millimeter for your particular dimensions, or it can be an off-the-shelf version that fits pretty darn closely. Fully adjustable and with particular straps that go on in a certain sequence, this brace is supposed to be worn in a very snug fashion in order for it to do its job correctly. The package will come with shims and pads of varying thickness so that you can tailor the fit more specifically. This brace shouldn't slide down, and that's because it uses the same silicone pad material that the prior Unloader 1 uses to help to hold it in place. In rare cases where the patient has quite a thin calf muscle but quite a wide thigh diameter, we can add an anti-migration strap to help keep the brace in place. This brace also comes in a variation that allows for the protection of your posterior cruciate ligament, or PCL. That brings me to a good segue. Not presently shown on the website, but available through our clinic, is also a specific PCL knee brace. This last knee brace is one that is particularly unique. It's a Canadian laboratory, and it's based out of Halifax. This brace is called a Levitation 2. And what's unique about this brace is that it's actually touted as being a tri-compartmental unloader. The prior braces that we've gone through today include braces that help to stabilize around the kneecap, or help to stimulate mechanoreception around the knee joint. Other braces that we've gone over talk about and help with unloading of one particular compartment of the knee, or helping to stabilize and protect various ligaments around the knee. What's unique about this brace is that it is truly able to unload the medial, lateral, and subpatellar compartments simultaneously. It does this by having springs built within the actual frame of the device. These springs and the cam that goes through the hinge are adjustable in terms of tension using a simple Allen key. With this Allen key, you can tighten or loosen the tension on the spring, allowing the brace to kick in sooner or to kick in later. It also allows you to change the overall magnitude of support that the brace is able to offer. People find this brace to be particularly beneficial if they're trying to come down or up a flight of stairs, whereupon they're putting a lot of compressive load into the kneecap. We think about the physics of a knee, and we have to think about the math that goes involved into it. If you multiply your upper body mass by the length of your femur, you end up with a very large number that is roughly equivalent to the amount of compressive load that your kneecap sustains with every step. This is obviously magnified when going up or down stairs or up or down a hill. The ability of this brace to offload the pressure underneath the kneecap is significant, and it's something that I'm very excited about. A couple of parameters with this brace, you can tell it's a fairly big brace. And so my personal and professional opinion is such that I think this brace will do better with larger patients, rather with taller patients, I should say. And they have to have a bit of a leg circumference that is equivocal, or at least roughly close to equivocal, between their thigh and their calf. People who have a disproportionately large thigh but have really quite a skinny calf will have a difficult time keeping this brace in place. Beyond that, this knee brace, as with all of our other braces, comes with free shipping, as well as a 30-day money-back, no questions asked guarantee. Visit us today at kneeclinic.ca and take a look to see if we can find you a brace that will help you get back to the things in life that you're passionate about.